Mr. Stein arrived at the outpatient clinic voluntarily, stating that he's experiencing a nervous breakdown. Mr. Stein is a 34-year-old male, married, and a business owner. During the initial intake visit, the following were found. Client expressed symptoms of worry, lack of sleep, agitation, frustration, feeling like he's being keyed up all the time. He mentioned that he's suffering from upset stomach and diarrhea, to which he'd previously seen other healthcare providers, but that all other potential diagnoses were ruled out. He's expressed decreased ability to concentrate, anxiety and tension, and feeling an overwhelming sense of sadness most of the time. Behaviors that were seen or found. The mention of increased irritability. Wife stated that he's been frequently yelling at people, including their 7-year-old daughter. Lays awake, staring at the ceiling. Wife states that he's tossing and turning in his sleep, and he suffers from frequent urination. He may have potential performance anxiety, as he mentioned in college that he never had any issues asking out a female, but when they said yes and they were going to go on a date, that he always worried about, was he going to go to the right place? Was he going to get the right thing? Was his car going to break down? Also, even though he made good grades in school, he never felt like he was good enough to be at one of the Ivy League schools that his family had consistently attended in the past. He mentioned that he uses alcohol or occasionally uses alcohol to calm down, but denied having an alcohol problem. Potential stressors. Negative self-perception. His parents got divorced 3 years ago, which also coincided with a company bankruptcy scare. He's worried about providing for his family, kids, and maybe even marriage stability. He's worried about work and whether or not work will be there in the future. The length of issues. The current onset of symptoms has been going on for about 6 to 8 months, but past symptoms, anxiety and worry, first appeared in college. Subsequently, 3 years ago, he began worrying even more about the potential of his company bankruptcy and also his parents' divorce. Now, further duration could go back even further than his college years, but future monitoring is needed to find that out. Now, the DSM-5-TR diagnosis and diagnostic criteria. A. Client conceptualization. The client is showing symptoms of excessive anxiety and worry while exhibiting behaviors of lashing out at others, irritability, and insomnia that are consistent with depression symptoms. The client expressed difficulties with family, work, finances, and negative self-perception that may contribute to the client's depression symptoms. The client expressed that the onset of more severe symptoms began about 1 year ago and are persistent most days. B. Diagnosis with F codes and specifier modifiers. A diagnosis of F32.1 major depressive disorder, single episode, moderate with anxious distress, moderate to severe. Client meets several criterions. Criterion A.1 is met as the client expressed feelings of sadness most days. A.4 is met as the client expressed a lack of sleep and inability to sleep. A.5 is met as the client expressed a feeling of being keyed up most of the time. A.7 is met as the client expressed symptoms of worthlessness throughout the conveyed conversation, despite not specifically stating that they were feeling worthless. And A.8 is met as the client expressed a decrease in inability to concentrate at work over the past 6 months. Diagnostic features and risk factors. A. Diagnostic features. Based on the DSM-5-TR diagnosis of F32.1 major depressive disorder diagnostic features, the client expressed symptoms associated with depressed mood, sadness, worry, and anxiety nearly every day, causing behaviors such as irritability, lashing out, and insomnia. The client's lack of sleep, feeling of sadness, and perpetual worry are common symptoms of major depressive disorder. And based on the DSM-5-TR diagnostic features of the specifier with anxious distress, the client expressed feelings of being keyed up most of the time, feeling restless, having difficulty concentrating, and the client communicated signs of consistent worry about bad things happening. Risk factors. The client is experiencing stressors such as financial and work uncertainty, family issues, and negative self-perception that can cause temperamental episodes. The client has not expressed any childhood experiences might cause current mood disorders. However, current family relations and negative self-perception suggests childhood issues that may need to be explored in the future. The client expressed occasional alcohol use to calm themselves down and past experimentation with illegal substances that coincided with past major life events, which suggests close monitoring, especially with certain prescribed medications. Modality or treatment plan for this patient. Because a patient showed potential signs of major depressive disorder during college, further and future observation could yield the patient's diagnosis of persistent depressive disorder. Thais et al. 2017 stated, because anxious distress in MDD is associated with greater depression severity and poorer response to treatment, as well as lower functioning and increased suicidality, early intervention is key, and objective observation and measurement of symptoms should be noted at each visit. Measured-based care, i.e., care that is systematically and quantitatively measured at each visit, is imperative, as well as the prescription or prescribing of antidepressants. The patient should also be a part of cognitive behavioral therapy.